A CDC specialist has cautioned the current year's terrible influenza shot might be in charge of the dangerous influenza pandemic clearing the nation. A portion of the patients I've managed seasonal influenza shot to this year have kicked the bucket, the specialist stated, including "I couldn't care less your identity, this startles the poo out of me. We have seen individuals biting the dust the nation over of seasonal influenza, and one thing almost every one of them have in like manner is they got this season's cold virus shot." Researchers were concerned the current year's influenza season would have been harsh and their feelings of dread have been demonstrated very much established. This season's cold virus season is headed toward a record-breaking begin, with the CDC announcing broad influenza action across the nation. Numerous well-being authorities trust that 2018 will at last be the most exceedingly terrible influenza flare-up that we have encountered since 1918. The CDC specialists' understanding of patients kicking the bucket of this season's flu virus subsequent to getting seasonal influenza shot is unfortunately normal. 8 Santa Barbara County inhabitants have kicked the bucket from this season's flu virus in the last fortnight. 7 of them had this season's cold virus shot. This savage example is recreating itself the nation over. However, well-being authorities are as yet advising individuals to get influenza shot, despite the fact that it doesn't function admirably this season. Well-being authorities have begun conceding that the immunization is just 10% successful. The decision is out on influenza shots. Numerous medicinal specialists presently concur it is more vital to shield yourself and your family from seasonal influenza antibody than this season's cold virus itself. Consistently the pharmaceutical business, medicinal specialists and the predominant press endeavor to persuade us to get inoculated against this season's cold virus. 2018 is the same. Be that as it may, of course, we are not being recounted the entire story. Pharmaceutical organizations furnish predominant press outlets with an immense level of their promoting income. Huge pharmaceutical organizations really spend significantly more on promoting than look into. We are talking several billions of dollars. Huge pharma's dollars have adequately acquired the quiet of predominant press. You can never again think anything they say in regards to pharmaceuticals, particularly antibodies. It is clear Big Pharma is edgy to guarantee prevailing press outlets never educate us regarding unfavorable responses or the harmful chemicals being infused into us in this season's flu virus shot. Flu antibodies contain risky fixings. The pharmaceutical business, restorative specialists and the prevailing press admit to us that influenza antibodies contain strains of the influenza infection. What they are less inclined to uncover however is the considerable rundown of different fixings that accompany the antibody. It is currently a well-established truth that influenza immunizations contain mercury, an overwhelming metal known to be risky for human well-being. Mercury danger can cause melancholy, memory misfortune, cardiovascular ailments, respiratory issues, oral medical issues, stomach-related uneven characters and different genuine medical problems. This season's cold virus immunizations really don't inoculate yet sharpen the body against the infection. Have you at any point seen how inoculated kids become ill very quickly following an immunization? This is on account of the influenza infection is brought into their bodies. So as opposed to inoculate, this season's cold virus shot in reality just sharpens their body against the infection. What's more, the way that it makes people get sick after a shot shows immunoconcealment, that is bringing down of the insusceptibility. Makes you more vulnerable to pneumonia and different infectious sicknesses. For somebody with an effectively smothered and vulnerable framework, infusing strains of the influenza infection can have crushing outcomes. In the event that your body is as of now attempting to ward off an infection or just working with low invulnerability, an antibody infusion could put your body in genuine risk of contracting flu with more grounded side effects, or surprisingly more dreadful pneumonia and different infectious ailments. Debilitates immunological reactions. There have been truly a huge number of restorative diary articles distributed that show infusing immunizations can prompt hurtful immunological reactions and a large group of different contaminations. In addition, frail immunological reactions just reduction a man's capacity to battle the maladies that the antibody should ensure against in any case. Genuine neurological issue. Confirmation presently proposes that fixings in influenza inoculations can really cause genuine neurological issue. In 1976, a noteworthy number of the individuals who got this season's flu virus antibody gained Guillain-Barré syndrome, GBS, a turmoil described by lasting nerve harm and even loss of motion. Influenza immunizations can contain numerous hurtful materials including cleanser, mercury, formaldehyde, and strains of live influenza infection. Would it be advisable for you to get an influenza shot? In the event that you are as yet lying, and pondering who to trust, think about this. The very individuals pushing influenza inoculations, and putting the dread of God into anyone who goes without, are making billions of dollars every year. It is safe to say that they are the general population we ought to trust with our well-being. In August 1999, the Committee on Government Reform started an examination concerning federal immunization strategy. This examination concentrated on conceivable or reconcilable situations with respect to the Food and Drug Administration, FDA, and the Centers for Disease Control and Prevention, CDC. The examination inferred that numerous people serving on two key warning advisory groups had monetary connections to the pharmaceutical organizations that fabricate antibodies. Frequently, these people were conceded waivers to completely partake in the talks that prompted suggestions on antibody authorizing and adding antibodies to the childhood immunization schedule. This in itself makes genuine uncertainty as to how compelling influenza immunizations truly may be.